I want to provide the latest information about the spread of COVID-19. To date, we have 27 cases. There are 11 cases in Maricopa County, 8 in Pinal, 1 in Graham, 2 in Navajo County, and 5 cases in Pima County. Arizona has community spread of COVID-19, and we are expecting more cases. Because of this, there is a heightened level of risk of COVID-19. Our goal is to mitigate the spread of the disease and lessen the impact on the people at the highest risk for serious complications. And people at the highest risk are older adults and people with underlying medical conditions like heart disease, diabetes, or lung disease. My team has been working tirelessly to ensure that Arizona complies with the new guidance provided by federal health officials this week. Federal officials are now advising the following. If someone in your family has tested positive for COVID-19, keep the entire household at home and contact your medical provider. We strongly recommend that dining establishments in areas of known community spread discourage dine-in traffic and instead provide curbside pickup or drive-through service. Do not visit nursing homes or retirement or long-term care facilities unless it's to provide critical assistance. Employers should develop protocols to work from home when possible. For those workers in our healthcare industry and pharmaceutical and food supply, your continued service is very important. We need this community to maintain their normal work schedule and follow CDC guidance to protect your health while you are at work. Everyone should avoid social gatherings in groups of more than 10 people, and we recommend avoiding discretionary travel, shopping trips, and social visits. As Governor Ducey and Arizona Superintendent of Public Instruction Kathy Hoffman announced on March 15th, Arizona schools are currently closed statewide through Friday, March 27th. We encourage people, particularly high-risk individuals, to have supplies on hand, such as extra prescription medications and over-the-counter medications. Take everyday precautions, such as avoiding people who are sick, washing your hands often, and cleaning and disinfecting high-touch areas in your house. Stay away from crowds if possible, and have a plan if you get sick to call your healthcare provider and to identify who else can care for you if your caregiver becomes sick. To stop the spread of COVID-19 and to protect our most vulnerable community members, we ask everyone to routinely implement infection prevention practices. The best way to prevent the spread of respiratory viruses is to do the following. So wash your hands with soap and water for at least 20 seconds. If soap and water are not available, make sure you use an alcohol-based hand sanitizer. Avoid touching your eyes, nose, or mouth with unwashed hands. Avoid close contact with people who are sick. Stay home when you are sick. Cover your cough or sneeze with a tissue and make sure that tissue makes it into the trash can. Clean and disinfect frequently touched objects and surfaces. And if you need to see a healthcare provider, consider using telemedicine. We urge everyone to find the most up-to-date and accurate data from reputable sources about COVID-19. You can visit our website at azdhs.gov or the CDC at cdc.gov. We also have the Arizona Poison Control System partnering with us to provide a hotline for the public and medical providers, and this hotline can be contacted at 1-844-542-8201. And I'm now going to turn it over to Secretary Hobbs.